So today we're going to talk about mental health issues when someone has ECD, but we're also going to talk about some of the other complications that can come along with having ECD, which is can be a very serious chronic illness. So let's talk about what are some of the things that I want you to learn from this talk. Importantly, I want you to learn about some of the causes of depression and anxiety. And we're going to look at how both the body and mind work together normally, and also how the body affects the mind and the mind affects the body when someone is ill. By understanding this concept of the unity of the body and mind, you will better understand how depression and other mood disorders can occur when you have a serious chronic illness. We also want to talk about how these mental health disorders can negatively affect your health. And importantly, today I'm going to focus on the men since that is who is most commonly affected. And we're going to talk about the importance of testosterone and the testosterone levels being low, and that how that can affect the symptoms of ECD and also affect your mood. The next thing that I wanted to get across to you is that when you become seriously ill with a condition like ECD, having a grief reaction to that is normal. It's a normal reaction to an abnormal situation because we're not supposed to be so sick. We're not supposed to be non-functional. We all have this idea of ourselves as being active, independent, functional, able to take care of business. And then we get hit with an illness and we find ourselves not being able to function. That has far reaching effects on our mind, and a grief reaction is normal. The next thing that I want to say is grieving is a process and it takes time. The best way to grieve is to go through the process actively. By actively, I mean by getting help and engaging with others. Specifically, what I don't want you to do is to isolate yourselves. Unfortunately, that occurs commonly, but it's not helpful. The next point that I want to make is that the experience of someone becoming very ill for some can be traumatizing in the same way that a soldier who's gone through combat can develop PTSD, or in the way that you see PTSD, post-traumatic stress disorder, occurring in people who may have survived a plane accident, something like this. So a person can develop PTSD. And the other important thing to know is that a family member can also be traumatized by seeing a loved one become ill and not be able to function as they once did. So we're going to talk more about that. The next point that I want to make is family members grieve too, all right? Just as the person who is ill grieves, the family members, most especially spouses, they grieve too. We're going to talk more about how that occurs and what can be done about this. Lastly, the last thing that I want you to take away from this talk is people often say to me that they feel out of control with an illness that at times seems to be taking them over. And it's true that you cannot always control how ECD affects you, but what you can control is your response to it and how to cope with it. That's the kind of the bigger picture here. And if you really can't, if you can't remember much from this talk, remember that, because that one thing will help motivate you. Okay, so we're going to talk about some facts here, and also the concept of the unity of the mind and body. So the first thing that I want to say is that I've gone back to research going back to the 70s and even some before that, that shows depression, anxiety, fatigue are common in people who develop a serious chronic illness, which I'll call an SCI. And I've listed some of those there. As time has gone by, researchers have become better at being able to study this. So I'm going to be um, talking about some of that research. This is particularly hard on people who have a rare disease like ECD because not much is known. And so the person is left with a big question mark. As I said before, a grieving reaction is normal because the person will often worry about how disabled am I going to be? How long will I live? What's going to happen to my family? How am I going to pay for all this really expensive care because I spend so much time going back and forth to specialists? Some of that care may not be covered by insurance, or some people may lose insurance. So, all of these things we want you to know are valid concerns, and they add to that grief reaction. We also want you to know that these feelings that you have, feeling depressed or down or anxious, they do not mean that you're weak willed or that you're crazy. They mean, or they show us that you are human. All right. And then I'm going to say again, what affects the body affects the mind, and what affects the mind and affects the body. That's the unity of the mind and body. We treat the mind and body as separately, then that's for because it eases making a diagnosis and offering treatment. But the mind and body are one. And I'm going to repeat this during the talk because I want you to begin to understand that and then begin to work with that. Okay, so here's the first slide. I'm showing you a picture of a man standing on the edge of a beach, and there's an enormous wave that's crashing and going to overwhelm him. This is how some people have described to me what it was like when they first got sick and they first went to their doctor and they first heard they have this rare disease, ECD. No one really knows anything about it. We don't know what the treatment is. We're not sure if the treatment is going to help. They have described it to me like being hit by a tidal wave. That's normal. It's easy to be overwhelmed by all of this. In some cases, people have gone from feeling either like themselves or maybe having a slow decline in health, but then at some point, they suddenly take a downturn. And that's when they find out. So, this is an overwhelming experience because the person is losing their ability to function, often because there are problems with the function of their brain, and because now the person needs help with very basic things that we all know we should do on our own, like hygiene and meals and driving. Then there's the issue that people will sometimes lose their jobs. And with job loss comes the loss of income and, very importantly, loss of health insurance. So that creates more stress, more feelings of being overwhelmed. So you see, as I'm going down this list, you're getting one problem is beginning to compound on the next, which compounds on the next. Then in the third bullet point that I have there, as all this is going on, and as a result of this, the person begins to lose their sense of self, who they once were, who they thought they were, who they thought they were, often their sense of self worth. Because here in a country like ours, we often define our worth and we define ourselves by the kind of work we do, that we're able to earn money, own a home, have a family, drive nice cars, and so forth. Then when all those things are either lost or the person is no longer in charge or in control of those things, that can be overwhelming. Now, next, I want to touch on some more intimate things here, and that is that becoming seriously ill will often trigger marital discord. I found that it's difficult for the men among us to be able to open up about this, but it's very common. That's the first thing. And secondly, we want you to know that it's not just common in ECD. I've seen this with other people who have cancer or Parkinson's disease, because both people who are in the relationship, their roles have changed. For example, the caregiver who was once an intimate partner has to shift from being that to becoming the caretaker. And that former role is sometimes lost. Now, the person who's ill went from someone who could be an intimate partner, who was able to take care of the home, who was able to pay bills. Now that person has become essentially a patient. And some people who are ill will say, "I feel like a child, and I feel like my wife is my mom, not my wife anymore." So you can see that what may happen because of the practical need for a spouse to take care of someone who is ill, that one was once a intimate equal partnership, can kind of change over time, and you have a caretaker and a dependent. That's something that creates great stress, and it is something that has to be worked on. You can work on that and you can resolve that, but the first step is to admit that there's an issue there. I'm going to skip some of these other things here for the sake of time. Um, on this slide, what I want you to see, probably the two most important things that I want to mention is it was also common, or it still is common, for me to see people who have become depressed and are on treatment. But when I questioned them, I found out that they had depression or some other mental health issue in the past, long before they got sick. They may have been treated at one time, came off treatment, symptoms came back, and they were kind of going along with that when they got ill. And now that untreated mental health issue becomes worse because of what I've just described to you. The other thing that can surprise the person and the family members is that when someone who has a history of depression, let's say, becomes sick, their depression can present differently than it once did. And we're going to go over some of those symptoms. Okay, now we're going to go into some of the medical complications. Um, for the purpose of today's talk, I'm not going to go over the condition on this slide. I'm going to save that if I give this talk again at a conference, but people can certainly ask questions after the talk is over, because for this afternoon, this is what I want to focus on. As I said, I'm going to be kind of honing in on the men because that's who is more commonly affected. I get this question often, and I want to point out that it is common for men with ECD to experience low testosterone levels. And the way this is diagnosed is by checking the blood levels. But more importantly, for all of you, is what does it do? How will I feel? Well, what you see here on the slide is men can become depressed, mental slowing occurs, apathy, and I'll just say apathy, I'm going to use it in the broader term to mean that someone has lost their motivation to function. I have seen some men literally spend all their day, every day in bed because they just don't feel like they have the gumption and the get up and go to get out of bed and do what they need to do. People also, especially men, become very fatigued and they can develop muscle weakness. Now it becomes physically harder for them to function. Energy levels go down too. So um, I'm highlighting this today because I've seen that among the men with ECD, the low testosterone levels causing symptoms like this are more common than the two other hormonal problems that I pointed out here, which is hypothyroidism and then dysfunction of the adrenal gland. So I'm going to stick with that, and we're going to pass over that. The other things that I want you to know is that some of the medications you might take can also cause low mood, fatigue, weakness. And then, importantly, there's poorly controlled pain. I'm sure that if I were to be able to see all of you in the audience and I were to ask you to raise your hand and tell me how many people in the room have some kind of chronic pain due to ECD that gets in the way of their life, many of you would raise your hand. That's very common. And in fact, this bone pain is probably the most common symptom that I see. What I want to say about this is that the bone pain can get to the point where it interferes with a person's ability to sleep. It interferes with their mood. It makes them more tired. All of that then causes more fatigue, more pain, more weakness. So it's like a vicious cycle. So I'm highlighting this now because I know it's very common. If this is your situation, we're going to talk about some things, but I want to bring this up. I want this to be on your mind. Okay, so um, we're going to talk about some of the signs and symptoms that you may notice in yourself or that a family member may notice in you. So, common things like a persistently depressed mood. This is not just feeling sad for an hour or two or maybe half a day. This is persistent. It's every day. The person is withdrawn, doesn't want to do things, may spend much of the day or even all day in a chair, hang out inside the house, not want to go out, not want to do things with their loved ones that they once really liked to do. And that brings us to the second point, which I've already described to you, anhedonia anhedonia, excuse me, and apathy. Now, what I want to say about this is um, we have to be careful when we see this. We have to be able to sort out what the cause is. Is the cause a mood disorder that has occurred, or is it some medical complication of ECD that's occurring that could be addressed? And often it's a combination of both, which is why you need to speak with your loved ones, tell people how you feel, get back to your doctors and explain what's going on. So I've seen people lose weight and I've seen people gain weight because they either can't eat or they deal with their feelings by eating too much. Some people may deal with these feelings by using drugs, drinking too much. These are not good ways to cope over the long term. And we're going to talk about that a little bit later too. Now, some people can feel anxious, get very anxious, and they may not be able to sit still. They get very fidgety. They'll be playing with things. Some people will get up and pace back and forth in their home. And when someone says something to them, they may jump and they're constantly in a state of fear. So that's kind of the opposite of of the depression picture, which I've shown you as a cloud here, those dark storm clouds, whereas someone who's very anxious seems to be spinning and swirling all the time. Please know that you can have both of these mood states. Someone can feel depressed at certain times and then get very anxious, and they can vacillate back and forth. So that's why I'm taking the time to explain both, because I want you to be able to assess yourself. Um, Next, with regard to the symptoms, as I said at the outset of the talk, someone may have a history of depression. And the first time that they were depressed, or the times that it's occurred in the past, the person may have been very sullen or withdrawn. And then when they develop depression as a result of having ECD, they may be uncharacteristically agitated and anxious with a short temper, and that's uncharacteristic of them. For some people, when they had been depressed or anxious in the past, it was hard for them to eat, and so they tended to lose weight. Now the opposite happens. Now they deal with their feelings by eating more, and then they gain weight, and that comes with its own set of problems. Same thing for sleep. Some people in the past may not have been able to sleep, and now people sleep too much, which is known as hypersomnia. So, um, what I want you to take away from this slide, and what I want you all to think about, is one thing that I mentioned at the beginning of the talk, which that grief is a normal reaction, but sometimes the process of grieving gets worse and a person can't seem to get past that, and the symptoms kind of grow from that point. At that point, that is when grieving may be depression, and you want to be able to identify it at that point, because you don't want it to continue to get worse. So, what are some of those signs? So, I've listed some here. When you're no longer able to function, when you are spending all day inside at home, and you are able to get up and you are able to move, but you feel like you just can't get up. I have had people describe to me the fatigue that comes with ECD as bone crushing fatigue. And I can certainly see how that could be. So if you're at this point where you cannot function anymore because you are so depressed or you are so anxious, that's not normal grief at that point. You need to get help. And then, of course, I always want to point out that if you ever feel that life is not worth living, that you would be better off dead, you're thinking about hurting yourself or someone else, those are all urgent signs that you need to get the help right away. Okay, so the next thing that I want you to know is you can get help. You can feel better. This is the part where you do have some control over your health and your health care, and I want you to take control of that. Once again, I want to say that feeling depressed, feeling anxious does not mean that you're weak or you are crazy. You're not. You're a human being. Going through an experience like this is tough. It's easy to get overwhelmed. People are there to help you. So, what do I want you to do? Talk to your loved ones, talk to a trusted friend, go to your doctor, tell them how you feel. We have wonderful ECD doctors, but as great as they are, they can't read your mind. So you have to open up and say, this is how I feel. There may be a role for medications, which I point out here. Um, Medications can be very effective, but they typically take a month or two, which is why you need a treatment plan. And a treatment plan not just includes taking a pill, it also includes therapy, getting out and joining a support group, and also doing rehab. Oh, I lost my slide. Okay. So, next slide here. What I would like to point out is that sometimes a glass of wine is good. But seriously, though, what I want you to know is to educate yourself on the signs and symptoms that we have been discussing. Talk to family members, talk to your doctors. There are therapists who are trained to help people through experiences like what some of you may be going through now. Also, support groups are another great way to get help. I'm going to pass on the other things on the slide. We can talk more about that at another time. So you can see right at the top of this next slide, I say be proactive. And I'm going to emphasize this again. I've already said this several times during the talk. This is something that you can control in your health and in your health care. Take advantage of that. This is something that you can do to help yourself and make yourself feel better. I want to point something out to the group, which is that we often have the idea that when we get sick, we go to a doctor, they prescribe a pill for us, and we take the pill, and then we get better. Well, that's kind of a model that we have in our head that that's the way healthcare is supposed to go, but it doesn't work like that with ECD. The medications help, but what they do to help you is that they help you lay the groundwork for you to do the heavy lifting of helping yourself to get better, which means physical therapy, occupational therapy, speech therapy, balance training, exercise, support groups, and so forth. That's the heavy lifting that you need to do. This is where a lot of the gain comes in getting better. Another thing that I want to emphasize here is that I have seen many times that motion, getting up, getting moving is actually good medicine for many people with ECD. So I've kind of highlighted that there. I want you to put that in your mind. You don't have to get up and join a gym. You can get up and start by walking around your house. You can stand and hold on to someone and march in place. You can get your cane, your walker, and just go back and forth. Remember, motion is medicine. Next slide. And some of my parting thoughts here that I want to offer you all is the first thing is please, and I'm speaking to the men especially here because I'm a guy and I certainly know that. Don't say everything is okay if it's not. Don't say no, I'm good. I'm fine. It's especially true when you go to the doctor and the doctor asks, "How are you doing? How's your mood? How are you coping with this?" And then you say, "Oh, I'm good, doc. Thanks." If that's not the case, then I don't want you to give that response. Rather, what I want you to do is open up and say, well, actually, I feel overwhelmed by all of this. I feel depressed. I'm anxious. I feel like my life is out of control. Open up about those things. That starts a conversation that then leads to a treatment plan for you. The next thing that I want to say is please, please do not isolate yourself. This is another common thing that I see. Um, Rather than retracting back inside yourself, I want you to expand and reach out to others. So I want you to do kind of the opposite of what you would naturally do, which is to shell up. Rather, I want you to open up. Um, Join support groups. Ask for help from friends. Maybe you can't walk right now. Have friends or loved ones or people come to your house and you can sit in the home and talk. And please get moving in any way you can. A couple of more things that I want to say here is please know that although this is hard on you, those who are ill, I want you to understand that this is hard on your family too. It's very difficult for them to see their loved ones not being able to function in the way they once did. There's also, you may be experiencing some mood changes, and now you're beginning to act in ways that you didn't act before. That's hard on the family members too. So they're going through a process just like you are. So you need to talk it out with those things. Please tell your loved ones thank you for all the things that they do for you, even the little things, because that means a lot to them. Okay, so my final thought is don't give up. All right, keep going, keep fighting, keep working on getting better. So we have about 15 minutes left. I want to thank everyone with ECD for being able to offer this talk. And here are some of the people that I work with.